Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Professional secrecy. Professional secrecy is a term of contact between the doctor and the patient. Here, the doctor is obliged to maintain the confidentialities of findings of the patient. These findings, which he had found out during treatment or during the professional work, all those things should be kept confidential. If the doctor does not maintain the professional secrecy, then the patient can sue the doctor for causing mental agony. If the patient is a major, that is more than 18 years of age, even his parents should not disclose the disease without his or her consent. Doctor cannot disclose anything to the public authorities except in case of notifiable disease. Condition of husband and wife cannot be disclosed to each other without their consent also. Examination of under trial prisoner findings cannot be disclosed to the police. If convicted prisoner, if the patient is, if the patient, if it is a convicted prisoner, then the examination findings can be disclosed to the patient, to the police. But if he is a trial prisoner, the examination findings should not be disclosed to the patient. During post-mortem examination, certain findings of the deceased which can defame the deceased or can cause mental agony to the family members should not be disclosed unless the finding is necessary for the investigation. Medical
thank you and thank you for watching.